Hello, my name is Luis. I'm going to be teaching you guys how to perform a barium enema, better known as BE. So first of all, I'm going to show you the materials you need to perform the BE. You need a barium bag, and then you need your double lumen tip with an air infuser to induce air, and then you need your cuff inflator. Make sure your cuff isn't torn or ripped. And you also need contrast. You're going to need some lubricant. You're gonna need some hemostats, some gloves, and then some towels. So once you have all your materials ready, you are ready to grab your patient. So, Joseph, hey, how's it going?
Good, how are you going to say?
What's your first and last name?
Joseph Rivera.
And then your birthday?
129/93.
Okay, double ID, check the bracelet, okay. And then if this was a female, you would ask for possibility of pregnancy. All right, was the procedure explained to you?
Yes, it was.
How did your cleanse go? How did the preparation go for the exam?
Good, I should be all cleaned out.
Okay, okay, perfect. Okay, so you're gonna have your patient change into a gown. Remove anything metal from the waist area. So just basically everything. Just keep your underwear on. But okay. All right, so you're gonna have her change. Go ahead and change. So you're gonna have your patient. The first image you shoot is a scout image. So basically, you just shoot a KUB. Once you have your scout images, now you're ready to tip the patient. So after you take your scout images, you want to put your patient in Sims position. So you're gonna have your patient bend their right knee, just like that. Roll onto their left side with their elbow up or shoulder up, just like that. Okay, so you want to have your barium bag about 24 inches above, no more than 24 inches above the table. You wanna bleed the line to get the barium to the tip. It's about there. You want to lock it in place. You want to lube the tip for easy insertion. And then now you're ready to tip your patient. So you're going to coach your patient through the whole process here. So I'm getting ready to tip you, okay? You're going to feel something. Okay, so take a deep breath in. You want to insert the tip 1 inch anterior and 3 inches superior. Once the tip is in, you want to inflate the cuff. Make sure you lock it in place. Lock your air cuff. Make sure it stays in place. Just like that. You feel okay? All right. So once it is locked in place and the balloon is inflated, you are ready to call the radiologist in to begin the fluoro procedure. So once the radiologist finishes his fluoro study, you take your post fluoro images. So you want to put for the first image, I'm going to take right lateral decubitus. So before you do that, you want to set your bag on the table here. And then you want to roll your patient onto the right lateral decubitus. You want to roll him onto his right side. You're going to put the plate behind him or her. Just like that. You want to center at the iliac crest, just like that. Feeling okay, sir? Okay. So you want to center at the iliac crest and the mid-sagittal plane. And for this, I'm going to use a technique of about 120 at 25 mass. So once you center, you want to put your left marker, because this is the left side up. Just like that. Okay, you want to shield your patient. Put this above you, okay? Just like that. Just like that. Okay. Hold your breath, don't breathe. X-ray. Once you shoot your first image, and you want to go onto your lateral rectum. So you're going to go back up into the bucky. You want to make sure you're detented. Detented. And make sure you're lined up. So for this one, you want to center at the as-is and the mid-coronal plane. So right about there. Like that. Good. Okay. This plate is no longer needed. Patient is on his right side. So you're gonna put the right side, the right marker down. Collimate accordingly. Like that. Shield your patient. Shield your patient. Alright, just like that. Hold still. Alright, X-ray. Alright. So once that is done, you want to shoot an RAO, so you're gonna have him lay on his stomach, RAO position. So your right side is gonna be down. He's gonna be rotated about 35 to 40 degrees. So that's in place. For this one, you want to center at the iliac crest, and then you want to center 1 to 2 inches from the midline to the elevated side, which is right about there. You want to open up collimation. For the rectum, you want to collimate a little tighter. So once you're out of in this position, just like that, you're going to shoot X-ray. So hold your breath, don't breathe. X-ray. So now you want to roll him onto a PA. So you want to lay flat on your stomach. Good. Just like that. Okay, so this one you're going to center mid-sagittal plane. Just like that. Mid-sagittal plane right there at the iliac crest. Just like that. Don't forget your marker placement. Do left on the left side. Just like that. Shield your patient. Hold still, okay? Alright. Don't breathe. X-ray. Okay, so now you want to do your PA axial. So you're going to do a 30 to 40 degree caudate angle. So you want to go 30 degrees there. You still want to be at the mid-sagittal plane. Make sure your bucky's aligned. Now for this one, you want to center at the as-is and mid-sagittal plane. Once it's lined up, to make that exposure, keep your marker on the right side, on the correct side. Shield. And hold your breath, don't breathe. X-ray. After this one, take the angle off. And you put your patient in an LAO position. So now you're going to be on your left side. Good, just like that. Again, 35 to 40 degree rotation. Just like that. Shield your patient. Good. Now you want to keep go right side on the right side. Even though it's oblique, you still want to have the correct side mark. So you're going to go 1 to 2 inches from the midline to the elevated side again. Make sure your bucky's aligned. Perfect. Okay. And X-ray. And then for your last image, you go out of the bucky again. You're going to go on your left side, just like that, as close to the board as you can. Good, just like that. Arms behind the board, good, just like that. Shield your patient once again. And it'll be at a 40-inch SID for all your images. There. We'll center at the mid-sagittal plane. Just like that. And then at the iliac crest once again. So now the right side's up, so you want to put your right marker. Just like that. And make sure you have light at the bottom to get the whole abdominal cavity. Just like that. Just like that. Okay. Hold still. Hold your breath. X-ray. And relax. How you feeling, sir? Feeling okay? Alrighty. So you are done with your images. Now you would get ready to remove the tip from the patient. So now I'm gonna remove the tip, okay? I'm gonna need you to hold, you're gonna feel the urge to defecate, but hold it in, okay? So we're gonna need you to go back in that first position you were in. There you go, just like that, the Sims position. There you go, good. All right, I'm gonna slowly slide the tip out, and you're gonna feel the urge to go, okay? But I want you to hold it in. So you wanna remove the cuff, or remove the air inflator, the cuff, air inflator, so the tip uninflates, and then you slowly pull it out. And then you make sure you have towels next to you, just in case it gets messy. So you're gonna remove it. Pull the towel. Can you grab onto the towel, sir? There you go. Good. Okay. So the tip is out. Your patient can now go use the restroom. Feeling okay? Alrighty. So have your patient go to the restroom, and once your patient uses the restroom, you have him come back, him or her come back, and you should have post-evac image. And that is all for the BE exam. Make sure you instruct your patient to drink plenty of fluids, water. Make sure the barium flushes out. And